technical audits to make sure that the management procedures are appropriate and the costs are also need to be contained, and there has to be some cost standardization. At the same time, we ought to ensure that along with this regulatory framework, there are also, and technical audits, there are also social audits to see whether the actual consumer, the individual, the patient and the family are also receiving the kind of care that they desire.
Financial inclusion, or ensuring that every Indian has access to money, has been a mantra for every government. Though micro-health insurance schemes have been plenty, they have been reduced to mere pegs on which election campaigns have been designed. And the fact is that today, only 11% of the Indian population has some form of insurance coverage. The problem is compounded not only due to the lack of proper implementation, but also lack of incentive. So, what can be the solution?
There's another point that I'd like to sort of touch upon is this whole concept of reimbursement, the whole reimbursement model. How do we deal with a insurance system which is a national sort of insurance system which doesn't get hijacked into state-sponsored insurance systems which then really don't deliver on what they're supposed to deliver?
Many of these insurance systems as they are currently constructed are like little life jackets or lifeboats being thrown into a river in Spate where many people are being washed around and a few people could be rescued, but it doesn't solve the problem. You actually need much sturdier systems. You also require universal health coverage, and that I think is an ethical requirement. It's a right of every citizen, but also targeted programs seldom work efficiently. It's only when it's universal then everybody has a stake in the system of having to make it succeed. Now this insurance system would have to be derived substantially from government paid social insurance, to some extent from employer paid insurance, and some people may wish to purchase private insurance as well, or it could be totally tax financed. But whatever be the final mechanism, if there is going to be an insurance system, ideally it must have one single regulator who actually brings in all of these systems into one unified framework again, so that people are not unnecessarily denied. There is no cherry picking, there are no denials of reimbursement claims for frivolous reasons and so on and so forth. Even if you look at other countries, it's very different. In some cases it's totally tax financed, government provided. In some cases it is insurance provided where the government purchases services, but with a proper regulatory framework. In Japan, for example, it's the private sector which provides the services, but government caps the costs and health insurance is compulsory. Now China has reconfigured its own plan and now has decided that it must provide more than 90% of the population with health insurance coverage. So we must study the global experience, not only in China, but Brazil, Mexico and elsewhere, bring out the best lessons from them and then bring back to ourselves. But universal health coverage, I think, has now become a non-negotiable healthcare requirement.
From your point of view, as the head of the Public Health Foundation of India, is this a key focus for you to really build at least this universal health insurance or health coverage? Absolutely.
I would actually try and extend the concept a little further. I'd like to use the word universal health protection, because universal health coverage is very, very important, and that's a key feature of universal health protection. But even if we were to devise a financing mechanism which will provide every citizen entitlement for a package of services which we believe is absolutely essential, if there is no health workforce to deliver it, if there is no infrastructure to deliver it, if there is no point of access to deliver it, that would remain an entitlement on paper. It's never going to be realized. So we need to fit all the pieces together. I think we ought to really ensure that financing is properly looked into, health workforce is developed, and is staffing adequately equipped healthcare facilities with substantial spread across the country, so that they are not concentrated in a few states and a few urban areas. That obviously drugs, vaccines and equipment are available at relatively low cost, both for the public system as well as the private system, so that the consumer is not unduly overburdened by having to pay for them directly or indirectly.
Yeah, today 80% of healthcare costs are self-pay.
Absolutely, 80% of the healthcare costs are out-of-pocket expenditure, and for the elderly in particular, the out-of-pocket expenditure is 4 times more than that of people in the working age group. So these are some of the anomalies that we must really look at. And thirdly, we must also look at governance issues. The amount of leakage of even available funds through government programs, partly through inefficiency and partly through corruption, that must be set right. Poor management must be set right. The supply chain efficiency must be enhanced. So unless we fit in all of these elements of the health system together, piecemeal attention to only one element is unlikely to result in adequate health care. So our foundation's effort is to try and advance universal health care as a combination package, and then trying to say, okay, while we are trying to develop the health workforce, we are also trying to look at health financing issues, we are also trying to look at how management can be improved, and let's try and move the health system on all the 4 wheels rather than on trying to just race on one wheel.
Dr. Srinath Reddy, a global leader in cardiology, is also a thought leader in driving innovations in public health. And as the president of the Public Health Foundation of India, he has a huge task at hand today to plan for a new healthcare system that will deliver on its promises.
What would be your timeline to deliver on that universal health
I think if we invest sufficient amount of public funding at the moment and optimally utilize whatever is being allocated and bring in the private sector resources into a well-crafted healthcare system which is regulated adequately, I think by 2020 we ought to be able to see substantial improvements, and universal health care coverage should become a reality by then.
That's at least, it still seems a long way ahead, but I think at least if we could start seeing sort of transformational kind of change coming into our healthcare system at least every 5 years, that itself would give us tremendous traction to get there.
Absolutely. I mean, I think looking at the financing mechanism is a possibility which can have in a shorter time frame. By 2015, possibly you might be able to work out mechanisms and build up institutional frameworks for that. But to roll it out and also to correct some of the anomalies in health workforce, like for example, you have I think 38 medical colleges in Karnataka and 8 in Bihar. So how do you correct the anomalies like that? So you ought to be able to provide the health workforce also where it's required to deliver the services that people are now going to be entitled to.
The healthcare sector is a huge job creator. I mean, that also we should realize.
Absolutely.
So I think it has a multiple kind of benefit aspect in terms of not only delivering good healthcare to its people, but also to create jobs, to create new skills. It has a very good positive impact on education. You can also then, of course, leverage all this by addressing your human resource, your needs in like places like Bihar and UP and others, where you know, your ratio of doctors to patients is so poor.
Absolutely, and given the fact that we have a young population and we are going to have a young population for quite some time, at least in terms of the age group between 15 to 59.
Yeah, but at the same time we also have an aging population which is huge in numbers.
Absolutely, the aging population which is growing needs a lot of medical attention, a lot of preventive health care. But given this fairly wide band of a relatively young and productive population who is looking for education, skills, employment, at the same time recognizing the growing healthcare needs of our society, if you can match skill development and employment to healthcare, and including preventive and promotive healthcare, then actually we will have a winning combination. Now, it need not be doctor-centric. We do require many more doctors. We certainly require even greater number of nurses, but starting from even the second auxiliary nurse midwife, starting from the second Anganwadi worker. Now we have only one Anganwadi worker who has to look at the nutrition of the 0 to 2 age group, looking at non-physician healthcare providers who can be trained as community health workers, also shifting from, we need specialist physicians, no doubt, but you need to shift some of the functions from specialist physicians to non-specialist physicians, and some from physicians to trained nurses. I mean, elsewhere in the world, people are talking about nurse practitioners, nurse anesthetists, public health nurses, nurse obstetricians. So we ought to be able to really expand the other layers of our health workforce while increasing the number of our doctors. So there's a tremendous potential now for rapidly expanding our health workforce with appropriate level of skill development suited to the needs. Primary health care doesn't require specialist physicians. So we have to recognize that reality. And if we can do that, then this disparities that exist between urban and rural areas, between different states, many of them can be corrected, if not completely eliminated, over the next 10 years.
Well, Dr. Srinath Reddy, that was a very interesting conversation, and I really wish you all the very best. I think all of us have to work together to make this happen, because we simply can't ignore the fact that the time has arrived for us to provide universal health protection, as you call it, but more importantly to create a sustainable and an affordable national health system for India. Thank you so much.
Thank you, because India's health and development are integrally linked, and I hope that all of us will recognize the importance of health in accelerating India's development on all fronts.
Thank you.